Hi, my name is Rajath, and I'm here on behalf of my father, Sathyanarayana Shetty. So, in fact, my father was, uh, having a bleeding in the rectum, and he had lost a lot of blood and the hemoglobin level. So, in fact, I think the problem persisted from quite some time, but it was never diagnosed, or it was not never so severe that we could get to know about it. So one fine day he started bleeding through rectum, and the bleeding was so severe that he had lost lot of blood. And in that situation, we had to take him to a hospital. So that's when I brought him to Kiran sir, and yeah, he diagnosed the issue very rightly, and maybe accordingly he suggested how to go about. So, as maybe Kiran sir had explained us earlier, so there were multiple bleeding in the large intestine, and he suggested that we had to undergo the hemicolectomy surgery. So before that, whatever the necessary procedures or the right diagnosis were done in terms of doing multiple tests or the angiogram and stuff like that. So definitely, in the course. We had also troubled Kiran sir in terms of
Not at
asking
all.
various questions
Not
and
at all,
stuff.
not at all.
But yeah, he had definitely gave us lot of confidence. So one another aspect here was my dad was. I mean, he's 76 years old, so we were very much concerned whether he can undergo all that procedures, whether it is possible for him to sustain such a painful process or whatever. But definitely, yeah, Kiran sir took us into confidence. He gave us a lot of confidence and said, yeah, he will have to undergo that procedure, and definitely he may have a better life after that. Right. So today, I would say, he is recovering very quickly. He is doing good. After the surgery, also, he is doing good. And now I can happily say his hemoglobin levels are picked up. So I don't think any more loss of blood is happening for him. Right. So, yeah, I mean, Kiran sir, thanks a lot for whatever you have done. And definitely, I think that right diagnosis and the right treatment is what has helped my father, and yeah, we are definitely happy with for coming to you and the treatment that we have got.
Thank you, Rajat. Actually, Rajat's father came, so his name is Sathyanarayana Shetty. He came with massive bleeding per rectum. Any bleeding will lead to hypotension. And most of the time, if nobody is there around, they may as well go into shock. He had a very tender, caring son. Took him to, he got us, they called me, asked them to come to Apollo emergency as early as possible. We stabilized him, we put him in ICU for a day, stabilized him, and checked his hemoglobin, which was very, very, very low. And then going through his history, he was having a low hemoglobin for a long time. So I don't know, somewhere something was missing. So then we took him for a colonoscopy. Very interestingly, very rarely find such findings. There are multiple small patches of oozes happening, not from single point, in the caecum, that is the first part of the large intestine. So if it was one point, we could have burned it, or some colonoscopic intervention could have been done. But it was a diffuse multiple patches. So then we took a decision to go ahead with the CT angiogram of the abdomen. That is the reading into the vessels of the abdomen, supplying the viscera. Then we could find a angiodysplasia of the caecum, which is quite a very rare entity, and it was only a focal. It was limited to the caecum. Fine. Then there were two options: either to go ahead with radio embolization or a surgical procedure. The only issue is the vessel supplying is an end artery. So any embolization would lead to gangrene of that segment and related further complications. So I considered the same to, I explained them the options and also told him what is right for them. So they were very understanding, even though they had many questions. I was quite clear in what I wanted to do, and I explained them what will benefit them. And finally, they understood that it has to be done. And good thing is that we did come as early as possible. We did the needful, and post-operative there was no issues at all, and there was no bleeding per rectum or anything. So age-related little pain tolerance was little not that low, moderately pain sensitive. Now that his hemoglobin is holding on well and is having quite uneventful post-operative period. I'm very happy to see him very comfortable and having his hemoglobin on stable side for a long time, and he will continue to have it so in future also. Yeah, a very rare entity, and we could do it in a methodical way rather than doing hurry or rushing into OT or rushing into any procedures immediately. We stabilized him, we evaluated very clinically and very methodologically, and find even though rare diagnosis, we dealt with it by proper clinical and surgical approach. Happy to see Sathyanarayana Shetty being very stable and happy right now.
Definitely. So even we are happy, and we are happy to getting or knowing about you.
Thank you, sir. Thank you.
So in fact, one of our the family physician. So I think
Yeah, Dr. Sudarshan.
Dr.
Is,
Sudarshan. He's Dr. Kiran's
my
friend.
friend.
So he's the one who recommended us to come and consult with
Yes, sir.
Dr. Kiran, and definitely we are happy
Thank you,
that we
sir.
came to Dr. Kiran, and it is good for us to know Dr. Kiran, and he is very much approachable also. So that also one
Thank you, sir.
additional
Thank
thing
you.
which I would say, maybe uh, normally doctors, or they won't share their personal numbers, and so, but Dr. Kiran was very much approachable. We could anytime go to him, ask us our questions, and so I could call him. So in between, I think after surgery also, one day he was having vomiting also, so I could immediately call up Dr. Kiran. He suggested what is that we should do. So overall, I'm very happy with.
Thank you, sir. Thank you. Because once we engage with some patient, we should make sure that they are always comfortable. And definitely, if at all you call me, you will never want to disturb me. You just will have some problem, so without which you won't call me. So that is the confidence I have in my patients. And most of the time, nobody has bothered me till now for unwanted things. And definitely, being a surgeon, anytime there will be some emergencies with my patients, so I have to be approachable. That's it. So I'm happy for my patients always. Happy
Thank you,
about
sir.
Sathyanarayana Shetty as well.
Yeah, thanks a lot.
Thank
Sir.
you.
Thanks for helping us out.
Thank you for
Okay.
coming.